it is interesting to look at the results of the OPERA TAVI registry. So the OPERA TAVI, the advantage of the OPERA TAVI, it's really a real life, real practice registry, a bit like a TVT registry, but smaller. It's international, multi-center. And they did an analysis, a super analysis in a small annuli patient using exactly the same definition as SMART, so 430. And they published this paper 2 weeks before the SMART, okay? And actually found, if you focus on the bottom right panel, actually found, again, some more high residual gradient, so mean gradient more than 20 in balloon expandable versus self-expanding, numerically also higher severe mismatch. But in counterpart, they found more moderate or severe paravalvular leak in self-expanding versus balloon expandable. And I mean, so they found more moderate or severe paravalvular leak in the self-expanding versus balloon expandable, which is, what is reported by most studies that did a comparison of balloon expandable versus self-expanding before. Of course, it's not randomized here, it's propensity score match, but interesting though. And for clinical outcomes, well, there was no difference between balloon expandable versus self-expanding, maybe numerically higher rate of events in the self-expanding, which was essentially due to the fact that the self-expanding had more stroke than the balloon expandable, okay? So this is real practice. But then when you compare the two, you realize that there are some intriguing differences. So again, the two, the OPERA TAVI and the SMART shows the more mismatch, high residual gradient in balloon expandable versus self-expanding, which is, typical. But on the other end, the OPERA TAVI shows much more mild and more PVL in the self-expanding. You see 48.5% versus 18.6%. But this is not only moderate and severe, this also include mild. And surprisingly, in the SMART, this is the opposite. And that's the first study comparing the two platforms where I see actually more PVL with the balloon expandable versus the self-expanding. So we'll try to explain this finding later. On the other end, there was more pacemaker in self-expanding versus balloon expandable, both in OPERA TAVI and SMART. This is also, a classical finding that we see. And now where it's getting interesting is in the distribution of the valve size. You see that in the SMART, there was about 1/3 of the patient in the self-expanding arm that had a large valve, a size 29, which is kind of intriguing for a small annulus population. There was also some large valve in OPERA TAVI in the self-expanding, but to a smaller proportion. And on the other end, there was very few patients with let's say, a larger valve, so 26 for the balloon expandable in the balloon expandable arm in both the OPERA TAVI and SMART.